Well, welcome to the News Forum special report. I'm Sheldon Neal, and the effects of the coronavirus have been felt around the globe. There is no question of that. But in particular, effects of this pandemic has left people living in poverty and already financially strained countries going without food and facing possible starvation. Well, joining me now is Carolyn Marshall, Senior Policy Advisor for Health at World Vision Canada. Thank you so much for joining me.
Thanks for having me, Sheldon.
Well, let's start here. You are the author of a recent report warning on the secondary health impacts of COVID-19. I want to make sure I get this right. You analyze and unpack things including malnutrition, particularly on children. Unpack some of your key findings from your report for our viewers.
Sure. So what we did for this report, following the UN's prioritization of 24 different countries, we used the impacts that we found from the Ebola epidemic in West Africa that happened from 2014 to 2016. And we modeled what would happen if those same impacts were to happen in the UN's priority 24 humanitarian countries. And what we found from that was that as many as 30 million children's lives could be at risk from secondary health impacts that would happen as a result of COVID-19. So this included things like 26 million children were at risk of potentially fatal infectious diseases other than COVID-19, such as diphtheria, pertussis, because they wouldn't be getting the immunization coverage that they had previously. We saw that potentially 5 million additional children could suffer from malnutrition. So they might experience wasting, which is, essentially suffering from the effects of famine. And we also found that potentially 100,000 additional children could die from malaria. And so that would be a 50% increase from what we were seeing before COVID-19. So that just gives you some of the potential impacts that we might see on these children.
Wow, I want to read some numbers to you here. 135 million people, it's being estimated, were already facing food shortage or food crisis issues prior to the pandemic. Now, according to the World Food Program, they're estimated as a number that 130 million more could go hungry, according again to the World Food Program, now that COVID-19 has been brought into this dialogue. What does recovery look like against the backdrop of such staggering numbers? I mean, where does one begin? Of course, with this pandemic, accessibility is an issue so I'm thinking even vulnerable countries who rely on money being sent to relatives or food being delivered. This is being cut off. There's pressures all around. How does one bounce back in the face of such staggering numbers?
Yeah, absolutely. It's going to be quite an intense recovery period. I would say that. I think that the first critical thing that needs to happen immediately is humanitarian food aid. And so that's where a lot of our work and where a lot of the World Food Program is focusing right now. As markets are closed, especially across the continent of Africa, where you're looking at more than 80% of people employed in the informal economy. Right now, people have no incomes and they're finding it really hard to put food on the table. So if we can ensure that we have access and we can provide humanitarian food aid to these countries, we can provide that baseline amount of nutrition that they need to survive. In terms of building back beyond that, we need to look at ensuring that market access is safe and accessible for all of these families. So we need to look at incorporating the impacts of any physical distancing that might be required and ensuring that workers have safe spaces to go to, but ones that also enable them to get that income back and to be able to bring food back to their families. And at the same time, what we need to be doing and what we're trying to incorporate into our own programs right now is ensuring that at the community level, we're still building capacity amongst community health workers to respond to COVID, but also monitor for impacts like malnutrition or the other secondary health impacts that I talked about earlier. The things that might not be immediately apparent, but that in the long term are going to be critical for countries to build back better.
Now, countries, this is not the first time countries around the world have faced issues such as food crisis, shortage. What makes COVID-19, this pandemic, unique in that discussion, though?
Well, the sheer scale of it, for one thing. I think previously, or not even previously, because a lot of countries are facing other food shortages as well. Like the Sahel region has been facing food insecurity for years now. But what's different about COVID is the incredible scale of it and the fact that really there is. There's barely a country untouched in the world. So not only are regions being impacted, but the ability of other countries to respond to them and to get that safe humanitarian food access in or to send their staff in for programming, these are also being limited now. And that's something that we haven't seen to this scale before. The Ebola epidemic is another good example of a large scale epidemic response,
Hmm.
but one that ultimately had the most significant impacts on three countries. So the rest of the world was able to support that and respond. But it's been an additional challenge, I think, for countries to balance the sheer volume of responses needed for this one.
Finally, are you, Carolyn, are you hopeful for recovery for some of the most vulnerable countries battling and still trying to do their best to keep their head above water amongst this pandemic?
I am hopeful. Absolutely, I think that one of the nice things in a way to come out of this is the stories that you hear about communities caring for each other. And
Hmm.
I think this has really fostered a global epidemic of caremongering in the way that caremongering has really picked up within Canada too. The state of Kerala in India is a really good example where they have a 250,000 person volunteer force that's taking meals and building camps for guest workers and making sure that people are taken care of. And I think that's being replicated in countries around the world. And a lot of NGOs like World Vision are adapting our work to respond to it as well. And so I think it will take a lot of time, but with a clear and measured response that we can absolutely come back from this.
Carolyn Marshall, Senior Policy Advisor for Health at World Vision Canada. Thank you so much for your time and for spending your time with us.
Thanks for having me.